Hello and welcome to the Do You Know Compartment Pressure Test infomercial. My name is Megan Hesketh and I'm going to tell you all about this gold standard tool for diagnosing compartment syndrome. Compartment syndrome is an increased pressure within one of the body's compartments which contains muscles and nerves. The most commonly affected compartment is the anterior compartment of the leg. There are two types of compartment syndromes, the acute compartment syndrome and chronic exertional compartment syndrome. Acute compartment syndrome typically occurs following a traumatic event such as a car crash or long bone fracture. The compartment undergoes a severe increase in pressure which results in insufficient blood supply to the muscles and nerves in the compartment. This syndrome is a medical emergency that typically requires surgery so that the lack of blood supply does not lead to permanent muscle and nerve damage. Chronic exertional compartment syndrome, in comparison, is an exercise-induced syndrome where the pressure in the muscles increase to high levels during exercise. The syndrome typically occurs in athletes who participate in repetitive impact sports such as cross-country, track, and soccer. They will undergo the compartment pressure test only if they are highly suspected to have compartment syndrome due to medical history and other tests because this test is quite invasive and mildly painful. How this test is done is that the first local anesthetic will be injected into the affected compartment so that a pressure monitoring needle can be inserted without pain. The patient will be laying supine on the exam table with his or her knees bent so that the sole of the foot is flat on the table and all the compartments of the leg are easily accessible. For the anterior compartment, which is the most common, the injection site is midway up the leg, staying close to the lateral aspect of the tibia and directly over the anterior tibial muscle. A needle is then inserted about 1 inch deep and saline is injected from a syringe into the muscle belly. The patient will then be instructed to increase their muscle pressure either by actively moving the affected muscles or by performing a certain exercise, such as running on a treadmill, until symptoms are reproduced. The pressure needle will then be inserted the same as before and will measure the pressure following exercise for the next 10 minutes. Positive results for exertional compartment syndrome will look at the pressure readings of the muscle when the needle was inserted prior to the exercise and post-exercise. Normal baseline pressure pre-exercise should be approximately 15 to 20 millimeters of mercury. If post-exercise readings are greater than 30 to 45 millimeters of mercury, then the pathology is present. Prior to taking this test, the patient, suspected exertional compartment syndrome, should continue to exercise up until the day of the test in order to reproduce the symptoms on the day of the rest and make the test more accurate. Following the test, the patient should not exercise for at least 3 days. They should also avoid baths or spas for 2 days until the needle holes are fully healed to prevent infection. There may be mild achy pain when the anesthetic wears off, so rice is recommended. There are no absolute contraindications for this test, but areas with overlying cellulitis should be avoided. Some complications may occur following the test, including infection, bleeding and bruising at the puncture site, and possible damage to underlying nerves and blood vessels. Also, if there is an increase in pain, swelling, throbbing, or numbness, this may indicate bleeding into a muscle and result in acute compartment syndrome, in which the patient should contact their doctor right away. I hope this video has helped you understand the compartment pressure test.